Hi guys, and welcome to the third concept of the digestive system. In this video, we're going to talk about the anatomy of esophagus. So what is esophagus? Esophagus is a muscular tube that extends from the pharynx all the way to the stomach because that is going to be the passage of food that we've already chewed in our mouth and taking it all the way to the stomach through the esophagus. It extends from the level of C6 at the pharyngeo-esophageal junction, and it ends at the level of T11 at the gastroesophageal junction. So in the esophagus, we have three important parts. The first part is the cervical part. It's at your neck, the cervical region. The second part is the thoracic. It's at the thoracic region. And the third part, which is the smallest part, it's basically around 1 to 2 centimeters only, and that is going to be the abdominal part here. So the first part is around 4 centimeters, the second part is around 20 centimeters, and the last part is around 1 to 2 centimeters. Now, to talk about each one of the parts, we need to know the relations. So the first part is the cervical part, and like we said, it starts at the pharyngeo-esophageal junction. So remember when we talked about the pharynx, we said that it ends as the laryngopharynx. So here that was your larynx. Remember the thyroid and the cricoid, and that is the end of that. Which is, remember the inferior constrictor muscle that has two parts, the thyropharyngeus and cricopharyngeus. That is basically making the first sphincter at the start of the esophagus, which is the cricopharyngeus, and that is basically your pharyngeo-esophageal junction. From here, it extends all the way down, and here is basically the cervical part of the esophagus. Now, if we want to talk about the relations, if you guys look at the esophagus here, you will see that anteriorly, can you guys see? Anteriorly, once you're done with the larynx, you are getting down into the trachea. So in front of the esophagus, you have your trachea. And if you look at this picture, you will find that in front of your esophagus is actually, we're having the thyroid glands and the recurrent laryngeal nerve. So again, in front of esophagus, you have your trachea, thyroid, and recurrent laryngeal nerve. And you will get to see recurrent laryngeal nerve in many relations to the esophagus. All right, so remember that it's anterior relation to the cervical part of esophagus. Now, what would be posterior to the esophagus, the cervical part? Definitely your vertebral column. It's quite simple. And what about the lateral parts? If you guys look at the esophagus, at the cervical region, you have your carotid sheath and its content. And you guys know what is the content of the carotid sheath. It's basically your common carotid artery. It's the internal jugular vein and the vagus nerve in between. Okay, and also you have the recurrent laryngeal nerve as a lateral relation to the esophagus. So esophagus, cervical part, is related anteriorly to the thyroid, the trachea, recurrent laryngeal nerve. Laterally, recurrent laryngeal nerve again, and carotid sheath and its content, which is the common carotid, internal jugular vein, and vagus. Posteriorly, it's related to the vertebral column. This is the cervical region. Now, what about the second part? It's basically your thoracic. So if you think about the thoracic part of esophagus, look at this. This is the esophagus, all right? All right, so if you think about the esophagus, it's basically here and also here. So to think about the anterior relation, remember that you have the left recurrent laryngeal nerve looping around the arch of aorta. Why it's only the left? Because you guys remember the right recurrent laryngeal nerve, it loops around the right subclavian artery, and that is very high, okay? So that's not going to be an anterior relation to the esophagus. So when we talk about the thoracic part of the esophagus, you need to remember that it's related anterior to the left recurrent laryngeal nerve. And we call it recurrent because it goes and turns back and comes back up. So that's only the left, all right? Now, what else would be related anteriorly to the esophagus? Of course, the trachea, because trachea will extend with us down because it wants to reach the lungs, right? So anterior relation to the esophagus, remember two things. Remember your lungs and remember your heart. So what would be that? In front of the esophagus, you have the trachea, all right, the left recurrent laryngeal nerve looping around the arch of aorta. You have stuff related to the lung, which is basically your right bronchus. Okay, it's not showing from here, it goes there. So the right, sorry, I mean the right pulmonary artery, all right, and the left main bronchus. All right, so the left main bronchus is related anteriorly to the esophagus. You can see it from here. Okay, and then you have your right pulmonary artery. So if you look at the right side, you will see the right pulmonary artery, and then it's the left main bronchus. So what about the heart? Remember that this is your heart. Your base of your heart is what faces the tubes at the back. So the left atrium is related to the esophagus. Can you guys see the bulging of the esophagus here? All right, so this is basically your left atrium. It's the base of the heart. All right, so here, this is the anterior relations to the thoracic esophagus. So again, when you think about the anterior relations, remember that it is related to stuff related to the lungs and the heart. The left atrium, the trachea itself, this is going to the lung, but you have the left bronchus, all right, not the right, okay, and the right pulmonary artery, okay. Now, what about the posterior relations? It's ATA structures, the ATA structures. They are the aorta. You guys can see that the aorta is related, arch of aorta is related anteriorly to the esophagus. Can you guys see the aorta? And then you have the thoracic duct, which I don't have it here in the pictures. And then you have your esophagus. So it is posterior to the esophagus, but when you look from the right side, this is the right. Remember that the esophagus is at the right side. The aorta is on the left side, but both of them are posterior relations to the esophagus. Here is your esophagus. How will you remember that? Posteriorly, you have the ATA structure, the aorta, thoracic duct, esophagus. And what else? Of course, your vertebral column. So vertebral column is a posterior relation to all parts of the esophagus. Okay? So thoracic, it has the more structures. It has things related to your breathing and blood circulation. Remember that the anterior relations related to your heart and lungs, your trachea, and as the air you breathe proceeds to the lungs, it's gonna go through the left bronchus and then the right pulmonary artery. Okay. Um, plus the left recurrent laryngeal, because that loops around the arch of aorta, but the right one is high up, so we don't get it as anterior relation. And your left atrium, because the left atrium makes the base of the heart. So the base of the heart is related to your esophagus, not anything else. All right, and posterior structure is the atta structure, the aorta, thoracic duct, and esophagus. Moving on, the abdominal part, it is related anteriorly, of course, to the left lobe of liver, because you guys know that this is a diaphragm and the liver is basically here. And if that will be related to something, so it's going to be related to the left lobe of liver, right? So anteriorly, your esophagus is related to the left lobe of liver. However, when you think about the posterior relation, it's quite simple, because you guys know that the esophagus needs to go through the diaphragm to reach the abdomen. So of course, it lies behind the diaphragm. So it's going to be related to stuff related to the diaphragm. And because esophagus is basically to the left, so everything posteriorly will be to the left. So posteriorly, it's related to the left inferior phrenic vessels going to the diaphragm, left cross of diaphragm. All right. And that is also related to the diaphragm. And then I have two important sympathetic nerves on the left side, which are the greater splanchnic nerve and lesser splanchnic nerve, because you guys know that these nerves come from the spinal cord, and then they would go inside and reach the abdominal area to supply sympathetic innervation to the abdominal viscera. All right, so the abdominal esophagus is related anteriorly to the left lobe of liver, and posteriorly it is related to the left cross. So if you guys look at this is the left cross of diaphragm. It passes behind the esophagus and also the inferior phrenic vessels. All right, and then the greater and lesser splenic neck nerves, all of them are to the left because esophagus runs to the left. And what about the right and left borders? If you guys look at the right border, you will find that it's continuous with the lesser curvature of the stomach. Here is your lesser curvature. So the right side is continuous with the lesser curvature of the stomach, and the right side is basically here continuous with the cardiac notch of the stomach. All right. Now, there are important constrictions of the esophagus. You guys need to know because when you are at the clinic, you need to know whether there is a blockage at the esophagus when you do the barium swallow, when you give the patient a dough with a barium and he swallows that, and you guys need to observe if there will be constrictions in the esophagus or this is a normal constriction. And we usually measure that from the incisors teeth, and then we bring that inside all the way down to see, because we need to know what are the constrictions normally and what is abnormal so that we can rule out if there is a problem or no. So we have four important constrictions, and these constrictions are made by the adjacent structures. All right. Whenever there is a constriction, whenever there is a transition in an organ, you need to know that at the beginning and at the end of that organ, there should be a constriction because we want to prevent the stuff going inside of that organ to backflow. So definitely at the beginning of your esophagus and at the end, you will find a constriction, and that is normal. So what would be that constriction? The first one and the last one, because these are the sphincters. So what would be one will start at the pharyngioesophageal junction, and that constriction is made by the cricopharyngeus muscle. Remember, that was the lower part of the inferior constrictor of the pharynx. And then the other sphincter would be at the gastroesophageal junction. So here we have normal constrictions. However, throughout your way down in the esophagus, you have another constrictions, and these are at these two levels. But what are these constrictions? Remember your ABC. The first one is the made by the cricopharyngeus muscle, and that is at the pharyngioesophageal junction. This is the start of the constrictions. Now, next to that is your ABC. One is made by the arch of aorta. One is made by the left main bronchus, which is B. It's your bronchus. Here aorta, here bronchus, and C is the at the cardiac orifice of the stomach. All right. So these are your constrictions, the normal constrictions you have in your esophagus. How will you remember the measurements of the constrictions of the esophagus? We start our measurement by number 6, which is 6" from the incisors teeth here. And then you have to add 3" to get to the next constriction you are expecting to see. So starting from number 6, you add 3, it becomes the next one, which is 9". Add 3, it gives you 12, and then add 3, it gives you 15". But to be honest, we have to make this -1, so actually this is 11. So the constrictions of esophagus, starting from the incisors, 6" for the pharyngioesophageal junction, 9" for the aorta, 11" for left main bronchus, and 15" for the cardioesophageal junction. Now, the blood supply of the esophagus, is taken by esophageal branches of the nearby structures. Remember that in the cervical part, we had the thyroid gland. Can you guys see that the inferior thyroid vessel, which is basically coming from the subclavian, it goes all the way to the thyroid. This inferior thyroid is going to give esophageal branches. And as it proceeds, you will see the bronchial vessels. They are going to give branches, and as you proceed, of course, your thoracic aorta is descending with the esophagus, so it should be giving it some branches. And then down you have at the lower part of esophagus, you have branches from the left gastric. All right, and also remember that it was the esophagus was related to the inferior phrenic vessels, right? So it's gonna definitely give. So just remember the structures that are around the esophagus and know that they are giving esophageal branches from the thyroid, from the bronchial, from the aorta, from the diaphragm, and from the arterial supply to the lower end of esophagus, which is the left gastric, because it supplies the part of the lesser curvature of the stomach. All right, it's quite simple. No, the important thing is the venous drainage. Why is it important? It's yes, okay, we are giving our venous drainage, we are following the same idea of the arterial supply. So we are draining blood from esophagus by esophageal veins, but there is very important concept here, which is basically when the esophagus drains its blood to the upper part, it drains eventually into the esophagus and hemiesophagus veins, and these veins eventually drain into the superior vena cava, and superior vena cava is actually a systemic venous system. What does systemic mean? It means it goes back to the heart directly without going to the liver. However, all the abdominal viscera, they need to drain the blood to the liver first, and then from through the portal vein, and then from the liver it gets processed to the heart, because we need to get the nutrition, we need to get everything, we're digesting the drugs, so many things need to go through the liver first, and then detoxification, a lot of stuff needs to happen at the liver, and then we take this to the heart. Now, the problem with the esophagus is that because we have two drainage system, one drains into the systemic circulation and another part at the lower end of esophagus drains into the portal circulation, one by the esophagus system up and the other part by the left gastric, because the left gastric drains into the portal vein. It goes then to the liver. The problem here is that we have anastomotic networks between the two systems. I have at the lower end of esophagus, all right, I have veins draining into the esophagus system, and I have veins draining into the left gastric, but I have channels between them. Normally, these channels are closed. But what happens is, if there is a problem in the liver, if I have a liver disease, and that disease is basically blocking the portal, the reception of the blood from the portal vein, this blockage can, like the liver cirrhosis or any liver disease, that can cause portal hypertension. It means the blood is going to be very high in the portal vein because it does not know how to drain the blood into the liver. What's going to happen is that the blood is going to come back, it's going to go to come back, find any way back, so it will go back to the lower end of esophagus. It will find another way out, which is the systemic circulation, and once this happens, those channels are going to open between the systemic circulation and the portal circulation because it does not have any other way back. So the channels are going to open, and as they open, this is going to cause something that we call it esophageal varices. So you will have a bulging of these the blood that came back to the walls of esophagus, and you will get to have varices in the lower end of esophagus. And if that is going to happen more frequently because of that persistent liver disease, it can end up having ruptured, these parts are going to get ruptured because very high pressure, and they don't know how to drain the blood away from that area, and that can end up having hematemesis. And hematemesis means vomiting of the blood, and in very severe cases that can cause death. All right, so with that, we're done with the concept of the esophagus. I hope you guys got the concept, and see you in the next videos. Don't forget to like and subscribe to the channel. See you.